Well, good afternoon, everyone. My name is Ruben Gonzalez. I work in the EFMP Central Cell Marketing and Outreach Office, and I will be your facilitator for today. So let's get started. Welcome, everyone, to the 22 February 2024 EFMP Connect. Today's conversation will be open mic. Our speakers for today will be Ms. Tammy Hearn, Director, EFMP Central Cell, Air Force Personnel Center, and Ms. Ashley Martinez, EFMP Respiratory Care Liaison, Medical Branch, EFMP Central Cell. So without further ado, Ms. Hearn, over to you, ma'am.
Thank you, Ruben. Good afternoon, everyone. Thank you so much for spending some time with us. I am Tammy Hearn, the Director of the EFMP Central Cell here at the Air Force Personnel Center, and glad to share a few things with you before we get to the one-on-one time with our subject matter experts. Certainly, it's great to see stakeholders from all over the portfolio, right? So thank you to our special needs coordinators and our family support coordinators who have joined. I see some slows, but most importantly, welcome families. Again, installation stakeholders, AFPC stakeholders, we are here in the hopes to answer any questions or maybe help you through a difficult application or a difficult time in your journey as an EFMP family. But again, thanks for joining us. We look forward to hearing from you today. Next slide, Ruben. So a couple of things that I want to talk about before we get to the breakout rooms. First thing I want to do is look back at 2023 and share with you some of the accomplishments, right? We've been at this EFMP transformation for 3 years now. And so it's always nice to look back to see where you are in the journey and to also identify, right, what gaps still exist so we can plan ahead for 2024. And I'll show you some 2024 initiatives that are in line to get done this year and talk to you how that's going to help bring enhanced care to our EFMP families. We'll talk a little bit about respite care and give you a respite care update. Ms. Martinez will do that. And then finally, we'll have those breakout rooms. As you can see, the portfolio is broken out. So if you have an assignment question, there's a breakout room from that, medical, family support, special education, and of course, respite care. You will be able to jump from breakout room to breakout room, but also know that in the assignments breakout room, of course, there's a couple medical folks in there. We have certainly put our subject matter experts across the breakout rooms in the hopes that you'll have minimal movement between them. All right, let's get started. Next slide, Ruben. Okay, so one of the big things we worked on this year, over the past 3 years, we have been moving very fast, right? Trying to incorporate new policies and procedures to get comprehensive care to families, right? Our special needs coordinators, our family support coordinators, those base level installation partners have been so patient with us as we gave them slides and SOPs, right? Those standard operating procedures and operations guides. And we gave them all kinds of tools, but the good news is for all stakeholders, the DoD 131519 EFMP was released this year, and we are simply attaching a DAFI supplement to that. So here you'll see DAFI 368201 will incorporate all of those Department of the Air Force policies and procedures. So like that, as EFMP stakeholders, you will have one document to go to find all of the policy that governs the program. That is officially in coordination, so we look forward to bringing you that sometime this year. We were able to really focus on rural specialty healthcare. For any of you out there who are assigned to those more rural CONUS locations, you know the struggle of garnering that healthcare specialty service. And I will tell you that's been a big focus area this year for us. Cannon Air Force Base Headquarters AFSOC led the way. Cannon, unfortunately, 1 in 2 families were not able to get to Cannon. If you were an EFMP family in need of specialty services, especially in the area of mental health or behavioral health, ABA services, it was difficult to get to Cannon, and many times we had to disapprove families going into Cannon because that healthcare was not available. You can imagine the impact on the AFSOC mission there, right? So again, headquarters AFSOC led the way in really bringing all of the stakeholders together to figure out how we help expand that care. DHA, the Defense Health Agency came to the table. Our Air Force Surgeon General came to the table. Of course, the EFMP Central Cell was there, along with the governor's health advisor from New Mexico, the local CEOs of the hospitals at New Mexico. It was a great opportunity for us to sit around the table and figure out how can we expand healthcare to bring families to Cannon. The good news is now that serves as a great template for the other rural bases across the United States. So the good news is we should see opportunities for many of our rural locations to expand care over this next year. We delivered special education legal assistance training to our JAG offices across the globe. So while healthcare and expanding healthcare services is always a priority, please know that doing the same on the special education side, priority as well. We ask our families to serve across the United States, and the Department of Education is required by law to provide the special education services our children need and deserve. When that doesn't happen, when a family encounters challenges with a school district, your local special education legal assistance folks can help. This is a new service built from the ground up about 2 years ago. So if you are a family that is struggling, please reach out to your local legal assistance office and they will be able to assist you. Whether it's a question about getting your child evaluated for special education services, or whether you just in process and the new school is not wanting to review that individualized education plan, or maybe they're not willing to give comparable services, or you're questioning, are these services really comparable to what my child was getting at their previous school? Those are all the things that the legal assistance community can help our families with. You can see that just last year, we helped 140 families get that special education help, and now their children are thriving, and we saved a whole lot of money, right? Litigation is expensive, and hiring an off-base attorney to help fight school districts can be very, very costly to families. That's, again, where the legal assistance community comes in, and we can work with the school and prevent these cases from going to litigation. So again, please help us spread the word and to help families know that this service is now available for them. Big shout out to our legal assistance community. We were also really focused on expanding our family outreach efforts. We brought in 7 families and a series of our stakeholders for a family summit in July of 2023. Again, direct feedback. Direct feedback has been the foundation of this EFMP transformation journey. And so we brought these families in along with the stakeholders so we could do a progress check, right? What have we done over these last couple of years? What are the gaps that are remaining? And you as families help us to know what it is that we can do to fill those gaps. Very, very good summit, and really the impetus for a lot of what you're going to see in 2024. We launched the EFMP Connect series. So just like we're hosting one today, we've hosted one every month now, I think 7 months in a row, and we will continue to do that this year. Each month we bring a topic and we get the opportunity once again to talk to families, to open up those breakout rooms and talk directly with you, answer your questions, get your feedback, and garner what those pain points are within this program. We've also built a partnership with our Air Force Wounded Warrior Division. I will tell you what a great partnership. Many things that our wounded warriors face, right? The same challenges that they face, certainly as EFMP families, we see those same challenges. We all utilize those same resources. So what a great way to just connect and be able to go out to our bases and share the Wounded Warrior word as well as the EFMP. We hosted the special needs coordinators. There are 150 special needs coordinators in our military treatment facilities who are there to assist our EFMP families and our families traveling overseas who need that family member travel screening. They are a great force, and I will tell you, it was great to bring them all to San Antonio. We have not all been together since this transformation journey began. So what a great event to come together, share best practices, understand again, what are the pain points within the MTF, where are those specialty healthcare issues, and how do we come together to fix those? So it was a great impetus to really getting to some good solutions to helping our families. If you're PCSing, you're going to meet your special needs coordinator, and trust me, they are of great help to you and your family as you navigate that transition. We energize that comprehensive support at the installation level. Families live their EFMP life right at that installation, and it's those installation services, those stakeholders right there at your base. And again, many are on this call who come to work every day, right, with the sole purpose to service families. So always, always, always utilize those resources, but know that we here from the EFMP Central Cell work to train them, give them all that they need to best support you. We ensure that they are working together at the installation level. Again, that comprehensive support is what our families need in order to navigate this complex program and to get the most out of the benefits that are out there. We piloted the Family Support Coordinator Basic Course. So the good news is when Congress put out all the changes for and required the EFMP transformation back in 2020, they were able to give each of the services some additional manning with those positions, right? We sent those out to the installations. The funding didn't come until this past fiscal year. So 1 October 2023, all those positions were funded. So our installations are now bringing those folks onto those positions. So you will see an additional presence of family support coordinators, which means that they will be able to get out into your units and meet you where you are, families, instead of you all having to go into the actual military family readiness center. So again, very excited to bring more support to our families, but that of course requires training, and we have that course up and running so like that we can welcome these new team members and get them trained and out there helping families. We did go through some respite care program changes. Again, in that NDAA 2021, Congress required that the military branches provide a standardized respite care program. Now, the United States Air Force provided the most robust respite care program. We provided 40 hours a month for families who qualified, and we covered sibling care. We advocated that that continue, but certainly when all the services came together and DOD had to draw the line of where funding would be, it came to a reduction for our Air Force families. So we are navigating that alongside of you. We are only cutting them because, again, that is what is required to standardize it. So now all Army, Air Force, Navy, and Marine families will have the same respite care benefits, and we utilize the same process to determine their level of need. Ms. Ashley will go into a little more detail, but certainly that has been a difficult change for our families, but certainly we want to walk alongside of you and help you as we make that transition. MyVector enhancements, we did make some MyVector enhancements this year. Certainly one of the great things that came out of the Central Cell and bringing all of the stakeholders together here at the headquarters was building the MyVector system and automating a lot of the family member travel screening process and the EFMP enrollment process. So now that we have MyVector, we have a lot of great data that helps us make good decisions as we move forward. It also shows us where cogs in the wheel may be. So again, we were able to do some, but I will tell you 2024, you will see a lot more as far as those MyVector enhancements. So let's look at 24. Let's see what's on the horizon for this next year. So the Central Cell came together a couple of weeks ago to really chart out our calendar year 24 strategy. We have 6 goals and about 50 objectives. This team does not stop. We definitely want to ensure that we are making strides and making things better for our families. Here are some of our major focus areas. So engagement and advocacy. I will tell you, the Central Cell walks alongside of you, advocates alongside of you, certainly knowing and communicating with our families and our stakeholders on a regular basis keeps us well informed. We get that pulse, and then that allows us, regardless of what table we're sitting at, whether that's a table with the Defense Health Agency, the Air Force SG, maybe it's with some congressional leaders. As a matter of fact, I'll be briefing the House Armed Services Committee in a couple of weeks, whether it's civic leaders, governors, and legislatures in our states that have Air Force bases. Please know that advocating for this great program is what the Central Cell lives to do. We want to focus on EFMP culture. There is a lot of information out there, right, about EFMP. As families, you navigate the journey, right? A military career as an EFMP family. And there are many myths. And what we hope to do over this next year is really start to untangle those myths, right? And put some facts out there. One important fact that really hit us hard earlier this year was, as we were screening the 2024 Wing Commander Select List, right? The Wing Commanders have been selected, and of course they have to go through the family member travel screening process as well, right? 19 of those 64 Wing Commanders are EFMP families, right? So a very small percentage of Air Force officers become Wing Commanders. So again, what are the stats, right? We hear often that EFMP limits my career, or if you categorize me as EFMP, it will impact my career. So what we really want to do over this next year is really bring the facts out, and let's have those conversations and bust some of those myths. We want to do much more outreach. Being out there with you, again, means that we always have our pulse on what your needs are as EFMP families. Roadshows, we have started our roadshows for the year. We started off with Tinker, Shepherd, and Vance Air Force Base. We go to Nellis in March, and then in April, we're going to hit the Northeast, and we're going to visit Langley, Hanscom, McGuire, and Dover. So your EFMP team is out there, again, meeting with families, meeting with the different stakeholders, meeting with those wing leaders. If anything, we love sharing with wing leaders what their population, their EFMP population is, and how they, right there on their base, can make such a huge difference in providing that installation support to those families. We're going to bring families back in for another family summit, right? You can't just have one and get good things out of it and not have a follow-up. So here we go again in 2024. In early August, we're going to bring families back in and have another summit. Again, let's see the progress we've made this year. Let's hear from the families how we've done. Let's hear from the families what those pain points still are. So we'll look forward to hosting families again this summer. We're going to launch an EFMP Family Ambassador Program, an opportunity to really bring about folks who, again, live and navigate the EFMP program, who can walk alongside other families who may be navigating some of the same challenges or the same diagnosis. So we will bring that about over this year. We hope to have ambassadors at every single location. And many of you probably right here on this call are parts of blogs or parts of a base network that you share information with other EFMP families. This is a way for us to formalize that. So again, we look forward to bringing this to our families. And you'll also see a caregiver, a family, EFMP family caregiver program that comes about over the year too. Our caregivers work tirelessly to support their active duty service member and their EFMP dependents. Some of our caregivers are EFMP enrolled themselves. So a lot to carry, and certainly we want to make sure that we are ministering to them and that we are providing them the resiliency tools they need to support their airman or guardian. We'll have that outreach for special education. Again, that's a big piece of 2024 is wanting to ensure that our families know about that legal assistance opportunity and that no one misses it and can actually garner that support within their local school district for that help. We're going to invigorate that comprehensive support. We talked about at the installation level, we have our family support coordinators, right? That EFMP family support coordinator is in your military and family readiness center. They're the lead for all things EFMP. They are connected at the hip with your special needs coordinator, with your SLO, with your housing office, with all those support entities. They are the connector to all of that. And they're your connection to your local community. So always, always, always utilize your family support coordinator. We want to reduce the family member travel screening timeline by the end of this year. Today, we have a timeline target of 80 days. Once a member gets their assignment, 8 days later, they get that notice. As long as their RNLTD is within 8 months, they get that notice right away that says, hey, let's start your family travel clearance. And then from that point until we get you an answer, we average about 80 days. We're wanting to really shrink that. Getting you an answer back is super important, and we want to do that as expediently as we can. So we're hoping to bring down the timeline for OCONUS to 60 days, and then the target for CONUS assignments, bring that down to 45 days. This will allow you and your family to get that transition going and prepare for that next duty station. And in the case that dependent travel is not approved, in other words, we checked that gaining location and the specialty services your dependents are receiving cannot be provided at the gaining location. That gives us time to work a new assignment with you and your assignment team here at the Personnel Center, it gives the assignment team time to replace your family, right, with another family so that they can fill that manning position. So we want to give those decisions back quickly, and we will work to efficiently do that. That means that process improvements are necessary. It means that IT, right, all those MyVector enhancements I talked about, both of those are very, very important to make sure that we are successful in doing that. And we are committed that by the end of 24, we will meet these new goals. Let's talk a little about electronic military healthcare records, right? We know that over these past couple of years, we've brought in Genesis. Genesis certainly is the way of the future for providing medical services, including access to military healthcare records here in the EFMP Central Cell and at the gaining location. When we are processing those family travel applications, the military healthcare record is what we use, right, to validate what services you're receiving and to validate, of course, what services are available at the gaining location. So those records being updated and current is super important to make sure we make the right decision. And I will tell you that's a struggle right now. You as family members, many times you are knocking on the door of your specialist trying to get those records so like that they can get into your electronic healthcare record. Our S&Cs work tirelessly to help to get, they send requests to your off-base physicians, again, trying to get those records. Without the most updated information, without a doubt, we're going to make the wrong family member travel screening decision. I will say this, right? Of all of the family member travel screenings, 11% receive an initial disapproval. Of those who ask for a reconsideration and maybe fill some of those gaps with the medical record updates, we overturned 60% of those reds to green and approved travel because now we have a complete record. So as a family, if you're seeing off-base healthcare specialists, one of the things you can do is every 6 months or so, or maybe your annual appointment with your PCM off-base, sign a release and have them send those records over to the base. And that way you can keep your healthcare record updating. Waiting until you get an assignment just adds angst. It puts a timeline on it. And I will tell you, there are some facilities that do it very quickly, but then there are other healthcare providers that aren't so quick. So help us keep that record updated, but please know that this is a high focus area for us too. We are trying to utilize Genesis to the nth degree and garner access to those records through Genesis. So again, know that we are working hard and we want to take that burden off you as a family, and you don't have to help us do that. We want to make sure that we have access, and we're not asking you to run around town and do that. Finally, we're going to do some work on the DAF Family Vector. I hope that each of you know about the DAF Family Vector website. I hope that you've been able to go out there and walk through it. There's a lot of great EFMP and family member travel screening information. One of the things I always like to bring up is the Medical Provider Trends Dashboard. That dashboard is out there to help families as they're looking for their next assignment, right? So we do a great job here within the Department of the Air Force of advertising assignment cycles, what's coming up, what's open that I can compete for. So when you see those lists, going out to DAF Family Vector and looking on the Medical Provider Trends Dashboard allows you, by specialist, right, to see 2 years worth of approvals and disapprovals for those locations based on those specialists that your dependents see. So let's say you're looking at Talent Marketplace, you see that there's a position open in Massawa and you're very interested in doing that. But your child sees a pediatric cardiologist every quarter, right? They're EFMP enrolled, so we have to continue that care and make sure that Massawa can see your child quarterly. You can go to that dashboard and look at the 2-year history and see how many times a pediatric cardiologist was available or not available. And that can give you a good sense as to whether Massawa would be a good fit for you and your family. It's not exact, because I will tell you, it could be that 30 days ago, a new cardiologist in the local area now takes TRICARE. That didn't exist before, right? But it's directional in nature. It gives our families a look into the historical view as they make those future decisions. So again, DAF Family Vector, just Google it and certainly it'll come up. But that Medical Provider Trends Dashboard is an excellent tool for those of you who may be coming up on a summer assignment cycle and you're looking at those choices right now. All right, next slide. All right, Ms. Martinez, can you give us an update on respite care?
Yes, ma'am. Good afternoon, everyone. Respite care has certainly been an important topic the last few months, especially for our EFMP Connect sessions with families and various stakeholders. As Ms. Hearn stated earlier, we started the transition to a standardized program across all of the DoD. One of these changes is using a standardized rubric to determine the level of need for exceptional family members. Based off this level of need is how we're determining family members' eligibility and the number of respite care hours they can receive. In our respite care breakout room, I will go into a more detailed review of the different policy changes and the different level of needs and hours to answer any more detailed questions. On the slide, we have kind of our timeline. As of Tuesday, we have received 753 recertification applications. We know families are working hard to get their applications in, and we truly appreciate it. In return, the medical branch and the central cell is working to get the level of need determinations back to all of our families. Previously, we had set a deadline for 15 January 2024 to complete the recertification process. We know that there can be extended wait times to get into a doctor's appointment or have the forms completed, especially as we came out of that holiday season. To ease some of the stress families were facing, we extended our deadline to submit recertification applications to 30 April. We are committed to navigating the respite care changes alongside our families. We want to ensure that we're giving families enough time to engage with other child care programs they may be eligible for. That's why we're starting our recertification in advance. 1 May 2024 is when services will be suspended for families choosing not to recertify with us. And by 31 May of 2024, we will have all level of need determinations out to our families. For those families that missed the 30 April deadline, again, benefits will be suspended. However, families can still reapply after this deadline. Again, I will be in the respite care breakout along with members from our Air Force Services team. and look forward to hearing from you there. Thank you, Ms. Hearn.
You bet. Thank you, Ashley. All right. Next slide. So here is a list again of the resources, many of which I mentioned during our time together. Please know that these stakeholders are at your installation level and ready to assist. In the meantime, though, you have us on the line. We are excited that you have joined us. We know that a session like an open mic gives us an opportunity to hear what's on your mind. And we know that you'll give us some great, honest, open feedback. So let's open up the mics, Mr. Rubin, and get these breakout rooms going. Ladies and gentlemen, we hope that the information was helpful. Our families and stakeholders who have questions, concerns, who may be on a journey and just needs a little help. And so we'd love to connect with you. We look forward to your feedback and your questions. You guys have a great evening. And again, thank you so much for being a part of this conversation.